Mysol.
Yes. Yes.
All right. You've had 3 surgeries done, multiple soft tissues. All right, fine. Don't worry about that. Can I put gloves தாங்க? Gloves இருக்கா? Okay, open your mouth. Okay. Bite. Bite, madam. बंद करो. വേണ്ട. Show your tongue. Okay. Take it inside. You want me to correct your tongue or no need to correct the tongue?
It's possible.
Yes, it's possible.
Tongue also.
Everything is possible. Only thing I cannot correct is the color. For the color, you have to do some laser and some of the different types of treatment for which I am not like the specialist. We will have a doctor down. You can meet her. They have lot of lasers and they can do some improvement. But generally, fully it will never go, this port wine stain. But we can make her face look normal. I can make the lip look normal. We can make the chin look better. The teeth are sticking out. I can put the teeth in the right place. Face will be balanced. She needs a few surgeries. Mainly, she needs surgery on the lip, surgery on the chin, and surgery on the teeth. Because what has happened, the large hemangioma is there. So what happens is our muscles are not intact. This is a orbicularis oris muscle. What this muscle does, it prevents the teeth from coming out. So she has not been able to close her lips properly for God knows 50 years, 40 years, something. Exactly. So what has happened, these teeth are also coming out a little bit. So if I only correct the lip will look nice, but still, when you look at her, you might be able to see these lower teeth. That is not desirable because whatever you say, she is able to lead a normal life with this condition. So I would still classify this as a surgery to improve her cosmetics or aesthetics. It's not an aesthetic surgery, it's a reconstructive surgery, but our idea is to improve her aesthetics. And also, of course, the bleeding will go away, everything. So we can do the lip, I can do the chin, we can do the tongue, and we can do the teeth. So that way our full face, except the red color, will be normal. You will need 10 to 14 days. That depends. 10 days minimum, usually 14 days maximum.
Hospitalized.
Yes.
You're in Bangalore or Trivandrum?
No, now Bangalore only.
Bangalore.
Yeah,
So
Trivandrum
you
we
have
can.
the facilities there?
Yes, of course. We will have it. We can't do it today or tomorrow. We will give you a date maybe next week. Then we can do it. We have all the equipment.
The competition that she is having that.
That is not a problem. They will no, they will evaluate all of this diabetes, hyperthyroidism, and they will tell you how
She
to.
had had that 3 surgeries earlier.
That's
Since
okay.
there, so
I can see all the scar.
yeah.
That I can give you result. Don't worry about all of that. It's not an easy surgery, but I've been handling more difficult cases. So for me, it's not a big thing. We can do it. That's a simple thing. I have recently done this guy from Colombo. I think it was 5 days or 1 week ago. I'll show you if I have the photo. I think it's there on my Instagram. I just took out a huge piece of thing for him. So this was him. This was done just recently. And it's, to be honest, it's not as difficult as that. Because what happens is her feeders, Manjuma, what is the important thing is that the feeders have to be able to control. It's like a river. Imagine this river is flowing a lot of water. You want to build a bridge or you want to block it. You have to stop water coming in. So for her, the feeders are not much when I feel. I know it. I will still do MR angio. I'll still do some tests. But I know with my thing that the feeders are not anymore that active. So what it means, I can control the vessels. If I control the vessels, the rest is not that hard. I can correct all of this aesthetic things. The hyperthyroidism, diabetes, blood, it is not a problem for us. No. As long as she gets medical fitness, I will do the surgery. Always it is like that. I will not tell you medical fitness is possible. That is not my department. If when she gets medical fitness, is what I say. Suppose they find something in the heart, they find that anesthesia for 4 hours, 3 hours, 5 hours is not possible, then we cannot do the surgery, obviously. But that you have to investigate and work out.
Approximately how long will be the surgery?
I need to know the
One
exact.
time will do the first.
Yes, sure. I don't want to do it again and again. One time we finish everything. I'm not going to do it again and again. I'm thinking it will take about 4 to 5 hours altogether, 4 hours. It's not going to be super quick, but we can fix it.
After that, 14 days hospitalized.
So 14 days is the time that you have to keep. I will see you after day 14. You might stay in the hospital for 5 or 7 or 10 days, depending on your healing, swelling, bleeding, everything. That varies. Sometimes 5 days, if everything goes well. Worst case scenario, 7, 10 days. That we're not able to predict precisely. But 14 days, why I say I definitely have to see you at that time again. If that's the time I know that everything is okay and good to go back and not come back again. That's why that 14 days for you. Whether I do bone,
How many days will it take to have a full recovery? All the swelling.
so immediately after surgery, you will see that your lip has become normal, chin has come better, teeth is better immediately. Of course, yeah, of course, immediately. That same day. So they have no. Don't tell me about what has been done. I don't want to get into that because, see, because what has been done,
Afraid, no.
huh?
I'm quite afraid, no. That's why.
You have to take a step of faith. I cannot help you do that. I can only tell you, and you can see the work that we've done, not one, not 10, not 100, thousands. And so then after that, it's up to you to decide. This is all we can do, right? I mean, I can give you 99% assurance from my side that everything will be perfect. But 100% something, uh, because we have to get the anesthesia clearance and everything else. Result, you don't worry surgically. Nothing will happen wrong. You have to get the other things worked up for you. Yes, immediately. On the table, I will take a video and show it to you once you recover. You know, this is not so bad. It's bad maybe for I had these huge crazy ones. So we've done 8 hours, 7 hours, and multiple. Baby things. Not an issue. Don't worry about anything. But we have to work you up. So that might take some time. We'll work you up again to keep blood. All those things my team will do.
Yes.
No combining with this. This is different. That you do later on, easy. Cosmetic things we can do very easily. Upper eyelid, lower eyelid, both we can do together. That's not something you want to really think of now. We can do it very easily. First, this I have to plan so much. Because when you get blood, cardiology, echo, ECG, hypothyroid clearance, blood analysis, that will take a while. All these people have to give clearance. I was just going to tell you something. Our anesthesia team, we have some equipment. They will give BP 40 by 20, 50 by 30, 60 by 40. Normally 120 by 80. What it means, the BP will be so less, I can operate there. It's like reducing the water on the river. If it will be trickling, easy to operate. Just trying to give you an idea of how it's possible. It is not possible to do this. You cannot go and cut. End of the story. So there are a lot of things that we will do and then do it for you. Sometimes I might make a small cut here. Scar won't be there. Sometimes that I'll decide after I see your scan. We have to see MR angio and I have to see some other things for my surgery. But do not do anything till you decide on the time and costing. Because unnecessarily it'll all get wasted. If you're not doing surgery, don't do anything. You want surgery, talk to my team, they'll tell you in range. Not less than this, not more than that. If we cannot very correctly tell the surgery, then after that you tell, okay, I want next week, next month, whenever. At that time, we'll start the process. So that whole process might take 1 or 2 or 3 days. Everything is a green tick, we can start procedure.